Hi, my name is Dr. Anate Brauer. I am a board-certified reproductive endocrinologist at RMA of New York. Using a gestational surrogate, otherwise known as a gestational carrier, can be a very daunting process with a lot of moving parts. From a medical perspective, it's actually quite simple, and I always like to divide the journey up into two parts. The first part is creating the embryo, and the second part is doing the embryo transfer into the carrier. So when you're creating an embryo, you need an egg and you need a sperm, and that can either be an autologous egg, meaning an egg coming from the intended parent, a donor egg if the intended parent doesn't have an egg to offer, an autologous sperm, meaning your own sperm, a donor sperm, meaning a sperm from a donor, to create the embryo. And we retrieve eggs, fertilize them with sperm, grow them out to an embryo entity that can then be tested for its chromosomes. Chromosomes means how much DNA does the embryo have? An embryo has to have a certain amount of chromosomes or balanced DNA to have potential viability for pregnancy and later on live birth. Once we have those embryos in the freezer, we can move on to start to try to find a gestational surrogate or a gestational carrier. And one of the best places to start with that is really through an agency. It's like picking a contractor to build a house, right? You want to talk to at least 3 agencies, maybe pick a couple big ones, maybe a smaller one. And they vary in terms of their interaction with you, their timeline to finding a surrogate, and also cost. And so it's really important to find an agency that you trust and that you feel comfortable working with. Once you find an agency, they'll ask you what you're looking for as far as qualities in a surrogate, location in the country, beliefs, etc. And they'll start giving you options for surrogates. If you preliminarily like somebody, it's called a preliminary match, and the agency sends the physician all of the medical records, and we review them here at RMA of New York, and those records are actually reviewed by 2 physicians, by our head of third party, as well as the physician of record, so your doctor. And once we approve that surrogate, we actually bring them here for an in-person screening and testing day. And they have all of their in-person toxicology screenings, psychological screenings. They meet with a nurse to learn how to use all the medications. And then once all of that clears, you go to legal clearances, and then you're ready to go. So we already have our embryos in the freezer. Now we have our surrogate. And the embryo transfer part of things is actually pretty straightforward. We just mimic a natural cycle. We thicken the lining of the uterus with about 2 weeks of estrogen. Once that lining looks good to go, we start progesterone, which helps stabilize the lining. And on the 6th day of progesterone, we bring the surrogate here for an embryo transfer. It's a very happy day. It can be a very overwhelming day, sometimes emotionally. But the actual medical process, it's about a 5-minute procedure. It does not require anesthesia. And you have a pregnancy test 10 days later. Success rates with surrogacy range usually around 60 to 70%. We do recommend that the embryos being used in a surrogate are genetically tested because that minimizes your chance of miscarriage and maximizes your chance of taking a baby home. I've experienced surrogacy with various agencies and various clinics, and I can honestly say that the team here at RMA of New York, our third-party team, the coordinators, the financial counselors, the nurses, are so invested in your care, and they will hold your hand through every step of the journey. One of the most common questions we get with gestational surrogacy is, where do I even begin? And this can mean different things for different people, and there's no right or wrong answer to any of it. My recommendation is always to start with the clinic because we have the resources and the connections necessary to recommend various agencies and various reproductive attorneys. So your patient care team here at RMA will help you coordinate with your agency, will help you coordinate with your reproductive attorney, and kind of get everyone on the same page to make sure we're rowing in the right direction and the most efficient route to get that baby home.